I've evaluated patients who've carried a diagnosis of bipolar disorder for years, only later to discover what they really had was untreated ADHD. And that may make some naturally wonder, like, well, how do I know if it's ADHD or bipolar disorder? And honestly, that's a fair question. And even experienced clinicians have to slow down and look carefully at the whole picture because these are two diagnoses that can look remarkably similar.
Take a whole day to recognize sunshine. When you need someone, I will be by your side. Hold on. There is a light that shines. That's for you and me. Yeah.
Hey guys, welcome back to the channel, or welcome if you're new here. My name is Tamika and I'm a board certified psychiatric mental health nurse practitioner. I also go by the name The Flagrant Psych NP, and I run a private mental health practice here in Michigan. But on this channel, we talk all things mental health in a way that actually makes sense. And as promised in the last video, today we're going to talk about distinguishing ADHD from bipolar disorder. We'll look at like where the symptom overlap occurs and what may be contributing to the confusion in making the diagnosis. And if you haven't had a chance to catch up on that last video, you'll definitely want to do so. I'll link it here because it talks about symptoms of emotional dysregulation versus an actual bipolar diagnosis. And now, before we go any further today, I do want to make an important point, and that is that ADHD and bipolar disorder can absolutely occur together. But in my clinical experience, I've more often seen them confused for one another. But that said, let's get into it today. And I want you to start by considering a scenario where a patient comes in to see me for an evaluation and they're like, hey, Tamika, lately I've been distracted, like I can't sustain my attention. My thoughts are racing. I'm talking a lot. I've been very impulsive. I'm shopping. I'm gambling. I've been hypersexual lately. I find that I'm restless. My activity is increased. I can't sit still. I'm always on the go. I'm not sleeping at night. I'm not completing any of my tasks at home, at work, or at school. I'm irritable. My frustration tolerance is low, and I'm overreacting to the smallest things all the time. And I'm having these anger outbursts. Now, here's the thing. Every symptom that this patient just described can occur in both ADHD and bipolar disorder. And they can even be seen in other conditions like trauma, anxiety, certain medical conditions, and sleep disorders. But because today's video is about ADHD and bipolar disorder, we're going to exclusively focus on those for today. But the point is that the symptom list by itself, it doesn't give me the diagnosis. Like, that's why a thorough psychiatric evaluation is so important. Well, here are a few reasons that I can offer. And number one is that unfortunately, some clinicians may stop at the symptom list, right? Instead of digging into the full story. And I think we're more likely to see this happening in the inpatient setting, right? It's one of the scenarios that I see the most in clinical practice. But when you actually think about it, when someone is in the middle of a crisis and they have to go to the hospital, the focus is really on keeping that patient safe and stabilizing their symptoms. So a lot of times there's just not enough time to explore childhood symptoms and developmental history, trauma, or the long-term pattern of someone's mood and attention. And as a result of that, sometimes clinicians have to rely more on what's happening in the moment. And without that broader context, conditions with overlapping symptoms can look very, very similar. And that increases the risk of misdiagnosis. It's when they transfer to an outpatient setting like myself that things are explored further. And then we could possibly uncover a misdiagnosis. Number two is that I've also witnessed reports of providers disclosing that they're just reluctant to diagnose ADHD because they're uncomfortable prescribing stimulant medications. And while this does not always necessarily result in a bipolar diagnosis, what it does mean is that ADHD isn't fully considered during a diagnostic process. And so when a diagnosis is influenced by concern about treatment rather than focusing on the comprehensive evaluation of the person's symptoms that they're presenting with, their history and overall clinical picture, again, there's a greater risk that ADHD may be overlooked or another condition may be diagnosed instead. Number three is I've also seen how cultural bias can influence this process. And so in many Black patients, I've seen symptoms attributed to bipolar disorder when a more thorough evaluation revealed a history that was much more consistent with ADHD, trauma, or both. So, in a nutshell, if we're not asking about childhood symptoms, developmental history, trauma, and the pattern of mood and attention over time, then we're not doing a complete diagnostic assessment. And this is how misdiagnosis can happen. Now, when I'm evaluating someone for ADHD, I'm looking for a lifelong history. I'm asking questions like, what were you like in elementary school or just grade school in general? Were you constantly forgetting things? Were you losing things? Were you daydreaming? Did your teachers notice? Did your parents? Were you last minute with things? Did you have to work harder for good grades or to sustain in school? And these questions are important because ADHD doesn't usually appear out of nowhere in adulthood. Remember, most people can trace those struggles back much earlier, even if they weren't diagnosed until later in life. Now, with bipolar disorder, I'm asking a different set of questions. I'm trying to determine whether there have been distinct periods where you weren't functioning like your usual self. I'm not talking just a stressful week or just a few bad days, but a clear change from your baseline with this accompanying euphoric feeling when you suddenly maybe needed very little sleep and still felt energized. Your confidence became unusually high. You were talking faster than usual, taking risks that normally wouldn't make sense, like spending money impulsively, starting multiple projects because your mind felt unstoppable. And then after all of that, did that version of you just abruptly end? Because that's what we're looking for with bipolar disorder episodes. And one of the biggest clues in helping to distinguish between bipolar and ADHD is sleep. So I want you to know that people with ADHD can have terrible sleep habits. Like they too can stay up at all times of the night because they're hyper focused or their brain won't shut off. But when it's time to start their day and be productive, they're tired. They feel miserable. They miss and feel the effects of that loss of sleep. Now, someone experiencing mania may sleep only a few hours a night for several days and genuinely not feel like they need more sleep. That's a completely different clinical picture. Another distinction is emotional dysregulation, and we touched on this in the last video, but people with ADHD tend to feel things very intensely. They can become overwhelmed, frustrated, or deeply affected by rejection, and their emotions can shift quickly, but they're usually tied to something that's happening in their lives. Now, with bipolar disorder, mood changes are driven by the illness itself. Remember, we used that broken thermostat analogy in the last video. And what's happening here is that the mood episodes aren't necessarily proportional to what's happening externally. And they last much longer than the emotional ups and downs we commonly see with ADHD. So yes, and I touched on this briefly in the earlier in the video. And in fact, one of the largest studies ever conducted to date on this topic shows that of adults with ADHD, about 8% of them, or 1 in 13, also have bipolar disorder. And conversely, adults with bipolar disorder, 17% of them, or about 1 in 6, also have ADHD. So this definitely shows that these disorders truly co-occur and more often than in the general population. And I've actually linked the full article in the description below. So if you want to take a look at it for yourself for more details, go ahead and check it out. So, all right, guys, we've actually reached the end of this video today. And I want to leave you with this, right? This wasn't a video about proving one diagnosis is right and the other is wrong. What it is about is understanding why they're so often confused and what a thorough evaluation should look like to help make the distinction. So I'd love to hear your thoughts. Have you or someone you ever known been diagnosed with ADHD, bipolar disorder, or both? What was the evaluation process like? Go ahead and share your experience in the comments below. Also, like, share, subscribe, and all the things. And until next time, take care of yourself. Bye.